All right, Mr. Smith, so I just did your initial examination, and there are a few things that I want to go over with you that are a little bit concerning regarding your oral health and your overall health. So the first thing I want to go over is the tobacco use. So you've been smoking cigarettes for 9 years and cigars for 2 years. So what tobacco does to your oral health is it makes your gums what we call fibrotic. So basically your gums are supposed to be a little bit soft, but fibrotic means they are kind of hard. They're kind of hardened. And what that means is the blood flow is decreased to your mouth. So if the blood flow is decreased to your mouth, then your body is unable to fight infections in your mouth, because that's what blood does. Blood helps fight infections and gets rid of certain bacteria and stuff. So if the blood flow is lessened in your mouth, then you have a less chance of naturally fighting off any sort of, decay, bad bacteria that's in your mouth. Also, it decreases your immune system, tobacco. So your whole immune system is going to be depressed, making you more likely to get sick, more likely to develop periodontal disease, which is bone loss. And once your bone starts to recede or degrade, it doesn't grow itself back. So tobacco really does have a negative effect on your oral and overall health. I know that it's hard to ask someone or expect someone to quit cold turkey, but there are multiple options as far as helping somebody quit. So you can try patches, they have the gum you can chew, you can go to counseling, therapy, just anything that works for you. But I really encourage you to try to quit. Ultimately the goal is to quit overall. But like I said, I know that's hard, so maybe just try to lessen it. So if you're smoking 1 pack a day, try to do half a pack a day at first, and then just keep getting less and less from there until you're ultimately done. And something else I wanted to say about the tobacco usage is that vapes or e-cigarettes are not a good alternative. So I know a lot of times people think that if they're smoking vapes, then it's better than their actual cigarettes, but that's not the case. The vapes or the Juuls, whatever, they have the same negative effects that tobacco would, plus more, because of all the extra chemicals and stuff that they add into it. So don't substitute one for the other. One is not necessarily better than the other. So just tobacco usage and vapes, we just need to quit overall. So the next thing I wanted to go over with you is the energy drink consumption and the orange juice. So you drink energy drinks and orange juice multiple times throughout the day. So there's a few things wrong with this. So we're going to start off by just going over why this is bad for your overall health. So I'm sure you already know, but energy drinks are really bad for your heart. They increase your heart rate and making you more susceptible to heart attacks, and that's not good. So energy drinks also have a bad effect on your mouth because they contain so much acid and so much sugar, just like orange juice. And what this does is when that sugar meets your teeth and any plaque that's on your teeth, what that does is it sits on your enamel, which is the hard outer surface of your tooth, and it breaks it down. So once that enamel is broken down, then your teeth can be sensitive because the enamel is the outer surface of your tooth, and once that's broken down, the inner surfaces of your teeth are exposed, and that's what leads to sensitivity. So a couple tips if you are going to drink energy drinks and orange juice, sodas, anything that contains a lot of sugar and acid. What we say is there's a couple different things. So first, just do not sip it throughout the whole day, because that increases the exposure time that you're exposed to the sugar and acid. So if you're going to drink a cup of orange juice, it's best to just chug it right in the morning or whatever, instead of drinking it all throughout the day. Because if you just chug it, then that orange juice does not contact your teeth for nearly as long as it would if you were sipping it all throughout the day. The next tip is if you're going to drink anything that contains high acid, high sugar, we encourage you to drink water in between. So what the water does is it kind of flushes your teeth and kind of gives it a clean slate almost, rinses away the sugar and the acid. And then the last tip is brushing your teeth after you do drink energy drink, soda, high acid, high sugar drinks, or food, is just brushing your teeth after. And again, that just creates a clean slate for your teeth, brushes any of the sugar or the acid away. And then the last thing I want to go over with you, speaking of brushing your teeth, I know that you said you have been using a hard bristled toothbrush, so I do not encourage that. I actually encourage the softest toothbrush you can get. So what the hard bristles do is it creates, a lot of friction against the enamel, which again is the hard outer surface of your tooth. And if you brush really hard with that hard bristled toothbrush, it actually wears away the enamel. And then that creates tooth sensitivity again because you are reaching the inner surfaces of your teeth. So we recommend a soft bristled toothbrush, brushing twice a day with a fluoridated toothpaste. So I'm going to prescribe you Prevident today because of all the cavities that you have. So Prevident is just a highly fluoridated toothpaste. You can get it at any pharmacy, and I'll give you the prescription for that. But ultimately, we do recommend a electric toothbrush to all of our patients because they are more effective than the manual toothbrush. The head can just move in ways that our hands can't, and they are more proven to remove more plaque than a manual toothbrush. So if you can afford a electric toothbrush, I highly recommend getting one of those.